Hello, everyone. Good morning. Thank you for being here. So we'll just get started right away. So yesterday we had talked about cartilage and bone. We covered cartilage and then we were going into bone, and then I kind of realized that we were going to be out of time, so I had to stop short. We had talked about with bone the classification, so that was long bones, short bones, flat and irregular. And then we had done the anatomy of a long bone. So when we talked about that, we talked about the periosteum, endosteum, and the different portions, epiphysis, metaphysis. So all of that we went over yesterday. And now we're working on the cells of bone. Okay. So the other remaining topics are going to be the bone matrix, and then lamellae and ossification. Okay, so we have a few more kind of topics that we'll go over. So for cells of bone, there are 4 types. Okay, we have the osteoprogenitor, osteoprogenitor. This is the mother cell. Okay, or the mesenchymal cell. It's the one that basically originates all of the other cells. So it's a stem cell that can become either an osteoblast or an osteoclast. Okay, so it has 2 options. And we said yesterday, if you guys remember, we said it was found in the endosteum and the periosteum. So if you remember, we said that that was we had like the drawing of the bone, and then we did the periosteum was kind of this covering around the entire bone. And then it had the little perforating fibers that went into the hydroxyapatite, right? And this was the periosteum. And so that has osteoprogenitor. And then we also said that there was a medullary cavity that kind of lines the inside, and it has fat, right? Medullary cavity. And this has yellow bone marrow, which is just fat. And lining that is the endosteum. So I'll do that like in red here. So this is the endosteum. And then that also has osteoprogenitor cells. Okay, so those are the 2 locations for osteoprogenitor cells. The second type of cell in bone is the osteoblast. And we can always think of the word blast as build up, right? It has blast, so you can think of it as build up. So what it builds up in bone is it builds up the hydroxyapatite. Remember, the hydroxyapatite is the matrix of bone, okay? So it's building that up, and then at a certain point, the osteoblast becomes an osteocyte. So the osteoblast converts into an osteocyte. So the osteocyte does not come from the osteoprogenitor. Does everybody see that? So the osteoprogenitor would birth the osteoblast, and then the osteoblast would birth our next type of cell, which is our osteocyte, okay? And our osteocyte, these have the function of maintaining the matrix. So they kind of keep it healthy. They break it down, build it up, maintaining the matrix and detecting mechanical stress on the bone. Okay, so they're kind of like our maintenance guys of bone. And then lastly, we also said the osteoprogenitor could give rise to the osteoclast, which is our last type of bone cell. And this one catabolizes the matrix. So C for catabolizes the matrix. The word catabolize, you can kind of think of it like catastrophe. It breaks down the matrix, and it does this using phagocytosis. So it phagocytizes the matrix to break it down. Okay, and this is the hydroxyapatite, which is the matrix here. Okay, so osteoprogenitor is the mother cell or stem cell. It can become an osteoblast or an osteoclast, either building up that matrix, making more of it, making it more full, or being the osteoclast, breaking it down, getting it smaller. And the reason it actually does this is to release calcium. And then for osteoblast, it's to store calcium. So that's the reason we build it up, the main reason, and then the main reason we break it down is to release calcium. You know how, they say drink milk to make your bones strong. That's because it has calcium, and calcium is what your bones are mainly composed of. Does this make sense? So we have the 4 types of bone cells. Okay. And then the other locations, I should have written this. For periosteum, we said that has the osteoprogenitor. And then it also has the osteoblast. I said this yesterday, but I'll just repeat it. And then the endosteum has osteoprogenitor, osteoblast, and osteoclast. The osteocytes are found basically within the lamellae, which we're going to talk about next as well. So those are the 4 types of bone cells. All right, so moving on, we're going to talk about our matrix and our spongy bone. So again, still on bone, let's talk a little more about the hydroxyapatite matrix. So there's a few things you should know about that. And then we'll also talk about lamellae. And then we'll talk about our spongy versus our compact bone. Okay, so for hydroxyapatite, remember that this is the matrix, like I have just said. The matrix, if you guys remember from before, actually has protein and ground substance. So if we want to get really specific here, the ground substance is the hydroxyapatite. So for your test, it gets a little more specific. So the hydroxyapatite is technically part of the matrix, but so is collagen. So collagen is the protein. And then the ground substance of the matrix is the hydroxyapatite. But when we say things like break down the matrix, really we're talking about the hydroxyapatite. But as everybody's seeing this, technically the matrix is 2 things, protein and then hydroxyapatite, so 2 components. Hydroxyapatite is actually made up of calcium phosphate and calcium hydroxide. So like I had just said, the main thing that we're building up and we're breaking down is calcium, okay? And that's for muscle contraction, which we'll cover next unit, when you guys get to unit 3, okay? So then we have lamellae. Remember, lamellae were part of the compact bone, right? So we have 3 different types of lamellae. We have our concentric lamellae. So this is our first type. And this is the lamellae you guys already learned about. So this is the tree rings that make up each osteon. So I'll try to kind of draw a quick little picture here. So if you picture your bone and we kind of slice it like a piece of bread, on the outside is our periosteum, like I have just showed you, but we're like looking at it from the top, if this is making sense to anybody, looking at it from the top. Our concentric lamellae kind of look like this, right? You guys remember those little osteons on the blackboard you just learned about last exam? Remember how we showed you that blackboard, you had to draw the picture? So let's picture there's osteons right here that I'm drawing, each of these being an osteon or a Haversian system. And remember that would have our concentric lamellae. So that's our first type of lamellae. They basically go around like tree rings, right? The next type, let's draw it in a different color, is our circumferential, circumferential lamellae. So this one goes around the entire circumference of the bone. So our circumferential lamellae would look like this, going around the outside as a few rings here. Okay, so this is our circumferential lamellae in red. So these are internal to the periosteum or the endosteum, so they can actually be in the medullary cavity as well. And they go around the entire circumference of the bone. So that's our lamellae type number 2. And then our lamellae type number 3 is called interstitial lamellae. And these make up all of the in-between spaces that the other two basically don't get to. So we would kind of draw like this. All of this stuff in between would be our interstitial lamellae. Okay, so we can draw that as the leftover portions of the osteon where they connect and are partially resorbed, which means like they're almost absorbing into the bone. The osteons, these little black circles, are like absorbing and evaporating or becoming interstitial lamellae. So just think of interstitial as in between. They are in between the kind of circumferential and then the concentric lamellae. As long as you know your basics of concentric lamellae would be the osteon, circumferential go around the whole bone under the periosteum, and then interstitial is in between. That should be sufficient knowledge for the test. Okay. Try to write out the full definition so it made sense. Any questions on that? All right, so our next little topic here is spongy bone versus compact bone, right? We have our two types of bone. So what's the difference between spongy bone and compact bone? So compact bone is the bone that you learned about repeatedly. It's the one that has the osteons. It's the one that is solid. It's the one that is on the external surface of long and flat bones. So everything you've gone over up until this point has been about compact bone. And you didn't really go over spongy a lot in last unit, but this time we're having you know a few things about it. So spongy bone is also, I'm going to write them up here. It's also called myeloid tissue, and it's also called red bone marrow. So it has three names: myeloid tissue, spongy bone, and red bone marrow. Its function is to perform hemopoiesis or hematopoiesis. And remember, we said this is the making of blood cells. So this is the making of red blood cells, white blood cells, and a little bit of the platelets, but platelets are really made technically elsewhere, but we're making the red blood cells and the white blood cells. The hemopoiesis occurs on trabeculae, and trabeculae are narrow lattice plates inside of the bone. So if you picture, we'll just pretend that this is my myeloid tissue that I'm drawing. Trabeculae kind of look like this, like these extra surface area. And if you picture that, this is where that blood is actually being made, is on these little trabeculae. Okay, so trabeculae are narrow lattice. The word he uses is lattice of narrow plates. Narrow lattice, wait, I did my words wrong. Narrow lattice plates, that works. And this is basically allowing additional surface area for the blood to be made, to create extra surface area for blood, for the making of blood. Does that make sense? Trabeculae are found inside of spongy bone, allowing more location for hemopoiesis. And one really important thing that will very likely be on the test is that the spongy bone has no osteons. So there are absolutely no osteons found in the spongy bone. So again, compact bone has osteons. Compact bone does not make blood. Spongy bone has no osteons, and it does make blood on the trabeculae. Okay, remember back in the beginning, where did we say the primary site of the primary site of spongy bone was? We said it was in flat bones, right? Because they do not have a medullary cavity and it's all myeloid tissue. So the primary, I'm gonna have to erase something, let's see. I'm gonna erase this. Okay, because this is important and I want to make sure I write down the locations. So the primary site for hematopoiesis is on our flat bones. Okay. Primary site of hemopoiesis is on flat bones because that's B/C for because they have no medullary cavity. These bones are the ribs, the skull, the pelvis, and the sternum. Okay, so not all bones have myeloid tissue. So for example, the long bones really don't make blood. Okay, so the main site of hematopoiesis is where we have the majority composition is myeloid tissue. Is this making sense? Is myeloid tissue. So they don't have a space in a flat bone to have that medullary cavity that I drew. And so because of that, because this medullary cavity is not in the middle occupying space, they have a lot more room to focus only on myeloid tissue and only on making blood. And so that's why the ribs, the skull, the pelvis, and the sternum are primarily for hemopoiesis and the making of blood. Myeloid tissue is happening mainly in the flat bones. Good. And just to be clear, all of this, these lamellae would be for compact bone, right? Those lamellae are not for spongy bone. Spongy bone is just the trabeculae for hemopoiesis. All right, so our next topic is ossification, and we have some growth patterns, and then we're going to move on to cardiovascular. So for ossification in bone, ossification is happening basically before when you're forming your bones, formation and development. So this is not something that's really happening for our entire life. For the two patterns, we have our intramembranous and then our endochondral. Intramembranous is going to be bone to bone, and then endochondral is going to be cartilage to bone. When I was on the test, I was very stressed about this topic. For me, it was kind of confusing because Knudsen talks about it for quite a while, and I thought that I needed to know all of these details. And I'll just tell you that for the test, you don't need to know a lot of details about this. I'll just make it very clear what you need to know. So intramembranous ossification happens when bone reossifies to bone. This is when it's bone at birth. And then we're going to say it reossifies back to bone. You need to know the steps. So you need to know that it starts with mesenchyme, goes to osteoid, then to woven bone, then to lamellar, and then that is it. You just need to know those 4 steps. And then for endochondral, You need to know that it's cartilage to bone, and this is going to be cartilage you were born with. This is the hyaline cartilage at birth, and then it ossifies to bone. There's an entire table that shows you a pattern of ossification. You don't need to know that. Okay, so this is it for ossification. That's all you need to know. So for growth of bone, this is something that is going to be a little confusing because it uses the same words as cartilage, but we want you to know it differently. So I'll make sure that we'll write it clearly. So we have interstitial growth in bone. And interstitial growth in bone is growth at the epiphyseal plate. You remember that that's at the metaphysis. So this means that the bone grows in length. If you guys remember in cartilage, so I'll draw a little note here. In cartilage, we also had interstitial growth, but this was 3D growth, and it had the newest cartilage on the inside. So does everybody see how this is different? Cartilage interstitial was 3D growth. Interstitial growth for bone is going to be bone growth in length. Second type of growth is our appositional growth. Appositional growth is going to be growth in diameter. Growth in diameter, and the location is at the periosteum. Okay, so the periosteum is growing versus cartilage also had appositional growth. So they have the same names. So this is why on the test you might get a little confused. Same exact name, but in cartilage, this was growth at the periphery or the perichondrium. Good. Periosteum, appositional growth in bone. Perichondrium, appositional growth in cartilage. Periphery is the word we're looking for cartilage. This is like the edges, versus in bone, it's at the diameter, like growing around. All right, I already talked about your blood supply. So I'm not going to talk about that again because I talked about that with your different foramens. There's a table for hormones and vitamins. Let me try to think real quick of what I remember being tested. Okay, I'll go through a really quick thing. I remember there was like, I think 1 or 2 questions on this, so I'll do a really quick thing and then we'll be done with bone. All right, so does that make sense to everybody? Make sure you just compare and contrast the two, cartilage and bone. Just don't get those confused on the test. Okay, so I want to talk really quick about hormones and vitamins because it is on the test and the table in the book is very long and I feel like it's a little overwhelming. So I'll try to just make it really simple of what you need to know. So hormones for the bones, these help control osteoblast and then osteoclast activity. Remember that clast catabolizes. So if a hormone causes osteoclast activity, it's going to increase calcium in the blood because it's breaking down the bone, releasing calcium into the blood. If it's an osteoblast activity, it's going to build up the matrix. It's going to decrease calcium in the blood because it's going to pull that calcium into the bone to build it up. All right, so those are the two basic concepts. Osteoblast builds up the matrix, lowering calcium in the blood. Osteoclast catabolizes the matrix, therefore increasing the calcium in the blood. So we have some different hormones, and there's a few questions on your test on this, so I don't want to neglect it completely. So growth hormone, this is responsible for performing cartilage growth at the epiphyseal plate. Thyroid hormone increases osteoblast activity. So if we increase osteoblast activity, what are we doing? We're decreasing the calcium in the blood, right? We have calcitonin. The best way to remember this is it rhymes with bone in. Okay, so calcitonin, bone in. So this is going to increase osteoblast and decrease osteoclast. So it's putting more calcium into the bone. Bone in calcium, putting calcium into the bone. Parathyroid hormone is going to increase calcium levels. So that means it's going to increase osteoclast. The glucocorticoids, these are another hormone, and these are going to increase resorption. So this is going to be increase calcium into the blood, so increase osteoblast. And then lastly, we have estrogen and progesterone. These increase osteoblast. All right, so try to maybe put those on some flashcards. That should be the quickest way to know those. If you can just remember blast or clast, and then like I told you, remember their functions up here. If on the test you're asked which of these increases calcium in the blood, just think which of them is for osteoblast. Does that make sense? So basically what we're saying here, oh, I lost my screen. What we're saying here is if it increases osteoblast, it increases calcium in the blood. Does that make sense to everybody? So kind of go over them. It's not a lot of your tests, so I don't want you to like panic, but I did remember on my test feeling like I hadn't studied this little topic enough, and I think I missed a few questions because I hadn't really gone over it as much as I could have. So just touch on it some more so that you don't, lose out on some easy points there. All right, so when it comes to vitamins should be pretty quick. We just have A, C, and D. So this is vitamin A, vitamin C, vitamin D. Vitamin A activates osteoblasts. Vitamin C promotes collagen production. And then vitamin D promotes calcium and phosphate absorption into the bone. Okay, so pretty simple with the vitamins, just kind of like, again, memorize your functions there. All right, and then our very, very last topic for bone. This is kind of aside from hormones and vitamins. When you repair a fracture in the bone, we start with a hematoma. So let's say you have a bone injury. This is like, you break your bone, It's going to start with a hematoma, which is kind of like a blood clot. This is the process you need to know for the test. The next step is going to be our fibrocartilage, soft callus. Then we're going to progress into our bony, hard callus. And then lastly, bone is remodeled. You may be asked on the test, which of these is the correct order for fracture repair, which of these is out of order. So I just don't want you to be like blindsided. Again, this is pretty simple to go over. Just go over that order of these. Okay, any questions at all? Okay, so bone, again, we talked about cells. We already talked about classification and anatomy yesterday, cells. And then we went over our lamellae within bone, spongy bone versus compact bone. And then we talked about our ossification and growth patterns. And finally, hormones, vitamins, and fracture repair. Yeah, what's that? Andrew, you have a question?
Yeah, can we briefly revisit the question you asked at the top? Which of these increases calcium in the blood?
Sure.
Um,
Yeah, go ahead.
I was just curious, why is it not osteoclast?
You know, that is a great question. I think it's because I was just talking and didn't read it correctly. Osteoclast would be right.
Oh, okay.
Yeah.
Thank you.
Yeah. And then if it said the reverse, which of these decreases calcium in the blood, it would be osteoblast. Good catch. Yes. My point there is just to make sure you know how it might be worded on the test, but I did just write that wrong. So sorry about that. All right. So let's go ahead and start cardiovascular system. If everybody's still with me, I don't know, I don't usually do breaks, but suppose we could do maybe 1 or 2 questions to kind of get us started into cardiovascular. So what is true about the right side of the heart? So maybe we'll do a few like intro questions and then we'll get going. And then what about the left side? Okay, so the right side of the heart. Does the right side of the heart, we'll just do like 2 options to make it easy. Does the right side of the heart work with oxygenated blood or deoxygenated blood? So everybody throw a guess. We'll do A or B. Does the right side of the heart work with A or B? B, right? So we're going to talk about that. We're going to say that basically when we're thinking about our heart, we have our right atria, right ventricle, left atria, and our left ventricle. And this right atria is going to receive blood from the body that has no oxygen, and it's going to transfer it to this lower chamber. Again, no oxygen. And then our left side, this is pretty easy to answer, would always have oxygen. So that's one of the things that will help you with learning the heart, is just as simple as that. The right side has no oxygen. Right side never has oxygen, ever, ever, ever. The left side always has oxygen, always, always, always. Okay, so just that very simple concept will help you a lot with as we kind of go through the heart. Okay, so if something has no oxygen, we obviously need to add oxygen to it. So just our little reminder of kind of some of the intro blood flow, and then I'm going to be going through it more detailed with all the different vessels you need to know. But blood with no oxygen will come in from the body into the right atria, go down into the right ventricle, and then we're going to send that to the lungs, where it's going to get oxygen and come back into the left atria. The left atria will send it down into the left ventricle. And then that left ventricle is going to send that blood out to the body, this time with oxygen. Okay. And then that body will use up all of that oxygen and bring it back again into the right atria. So you can kind of see we have some different circuits going on, right? If I kind of erase this, you can see we have this circuit here, basically going to the lungs and coming back. And then we have this circuit here going to the body and coming back. So this is our systemic circuit. And then this up here is going to be our pulmonary circuit. Okay, and we'll talk a lot more about each of these things as we go through it. But let's kind of go back to the beginning of some of the intro terms with the heart. So remember that the heart, the location is going to be 2/3 mediastinum. So what this means is, it's easy for me to remember if you just put your hand on your chest like you're doing Pledge of Allegiance. 2/3 of your heart is on the left, right? If you guys put your hand right here, most of my hand goes towards the left side of my body, and 1/3 is on the right. That's just an easy little test question. You'll probably get that, that test question just like that. Where is the heart located? It's inside of the pericardial cavity. And remember that the pericardial cavity is in the thoracic cavity because that's where your lungs are also found, right? Thoracic cavity would also have your pleural cavity for your lungs. Remember this pericardial cavity. Inside of that, do you guys remember the pericardial sac that surrounds the heart? We learned about that in the last unit. And then we also have the rib cage that protects the heart. So this means that the heart is really essential for survival because it's protected by the sac and by the rib cage. Does that make sense? Okay, so we keep things really, really safe. All right, so our upper chambers, I really like this. I heard this recently. So they are the upper attic chambers, and we call those the atria. So just think the top ones, attic or atria. The lower chambers, these are our ventricles. And these ones act as the pumps, and the atria act to receive blood. So if you look over here on our diagram, the atria were receiving this blood, right? The right atria receives blood from the body that has no oxygen. What about the left atria? This receives blood from the lungs that has oxygen. Either way, the atria are receiving blood. What about the ventricles? The ventricles down here, this one sent blood away. So this is a pump. And then on the left side also pumped the blood. Okay, so it's a very simple concept right now. We're not getting into a lot of detail. We're just saying the simplicity of atria receive blood, ventricles pump blood. Honestly, if you can just walk away with this from this class with that, that's more than some of the people that are in my nursing program remember from anatomy. And I don't mean any type of like disrespect to them. I'm just saying, try to walk away from this content with remembering as much as you possibly can, because you will have to learn it all again if you don't understand it all now. So we're like right now in my program, I'm in 3rd semester and we're going over the heart right now. And there's a lot of people that are having to go all the way back to their anatomy notes and try to figure this all out again, just because at the time, I think they didn't really understand it because it is really complicated. So I want to encourage you that your time is not wasted. If you really spend the time to get it now, you will be grateful later on. Okay, so don't feel discouraged. It is complicated at first, but you will get it. And the more you get it, the better it will be for you as you move forward. Okay, so again, our atria are receiving our blood at the top. Our ventricles are pumping our blood at the bottom. All right, no oxygen on the left, on the right side, oxygen on the left. And just to make it, I know that probably you remember this, but remember our right side and our left side are flipped. And the reason they are flipped is because we're pretending we're looking at another person. So if I look at you right now, your left side is on my right and your right side is on my left. So that's why we do it this way and we flip it around on the screen, because we're pretending we're looking at somebody else. Okay. Yeah, you have a question about the pericardial cavity? Sure, go for it. I'm about to go over all the coverings of the heart. You have a question about pericardial cavity. What's your question? I'm not seeing your question. You're welcome to type it if you want. Oh, I can't hear anything. Can you guys hear her? Or him? Not sure. I don't think we can hear you. Okay. I'm just gonna start writing, and then when I see your question, I'll answer it, okay? So layers of the heart. So we have the sac layers, and then we also have the heart layers. So the sac layers and then the heart layers. The pericardial cavity is the space between the lungs. That's a good question. So I'll try to make a little drawing to make it clear. So yes, the pericardial cavity for your cardiovascular packet is described as being the space between the lungs. But you know, it's kind of, yeah, that's, so if we picture this is like our lungs, I know they look a little interesting, but our heart kind of sits like this inside of the pericardial cavity. So yeah, overall, you can kind of say that this space here is our pericardial cavity, and it sits in between the lungs. I don't believe that it's 100% in between the lungs, but it does occupy the space in between the lungs. So yes, that would be an accurate answer to the question in your cardiovascular packet that asks you, what is the name for the space in between the lungs? And yes, you can say pericardial cavity. Good question. Okay, so for the sac, remember that the layers around the heart, we have the sac layers, which is composed of 2 layers and then one has a sublayer. So the outermost layer of the heart is called the fibrous layer, and this is the outside layer. And then our next layer is the serous membrane. And the serous membrane has 2 layers. It's the inside layer and it has 2 layers. So I'm going to do it like this, an A and a B, okay? So the outside layer of the serous membrane is called the parietal layer, okay? And again, just to be clear, also called the parietal pericardium. You guys remember learning about the pericardial sac, right? So the parietal layer, or the parietal pericardium, is the outside layer of the serous membrane. Okay, and then we have our next layer, which is our visceral layer, or our visceral pericardium, and this would be the inside layer of the serous membrane. I'm going to just write inside layer, and then I'll put SM because I feel like that's pretty clear, serous membrane again. So if we're picturing our heart, okay, so my heart, I have my fibrous layer, right? Fibrous. Then I have my parietal layer. Remember, there's no serous membrane layer because the serous membrane just has an outside and an inside. So here's my parietal, and then I have my visceral. Okay. Floating in between the parietal and the visceral, do you guys remember what's in between those two? Hopefully that's ringing a bell. Remember, we have the pericardial space with the pericardial fluid. Does that sound familiar? That's because it's the same as the serous space with the serous fluid, if you guys remember learning about that on the last exam. So the function of our pericardial fluid is to pull away heat from friction. So as your heart beats all day, it creates this heat, and that pericardial fluid pulls that heat away. So we can kind of draw that fluid like this. We picture it kind of floating in between this space here, protecting the heart from getting like overheated. Okay. All right, so now we have the layers of the heart. So the actual heart itself. So inside, we're going to have our heart with its 4 chambers, right? Right atria, right ventricle, left atria, left ventricle. but the heart itself actually has its own layers. So just now we talked about the sac layers, not the heart layers. The heart layers start with the epicardium. So let's see, what color do we want to do? Let's do yellow. Epicardium. Okay, epicardium is sticking. Can everybody, I think we can all read the yellow, right? Can we see the yellow? Am I writing big enough? Sticking closely to the visceral layer. Okay, sticking closely to the visceral layer. This is made up of epithelium and connective tissue. It is a very thin layer. Okay, so we're going to kind of draw it like this. All right, so it's sticking really closely to that green or visceral layer, and it's called the epicardium. The next layer of the heart, so that was layer 1. The next one is our myocardium, okay? Myocardium. Myocardium is the cardiac muscle layer. So this is what allows the heart to pump, okay? It is the muscle itself. And if it becomes inflamed or infected, we have a condition called myocarditis, which is inflammation of the heart muscle. So we can kind of draw that heart muscle like this, right? Picturing it kind of going around the heart. Don't you think it would make sense if the ventricles are pumps that the cardiac muscle would be thicker where the ventricles are, right? So I'm going to draw it thicker down where the ventricles are. And it's actually the thickest on the left ventricle. And the reason that the myocardium is so thick on the left ventricle is because the left ventricle has to send blood out to the body. All right, so this is the myocardium. The myocardium is the thickest at the left ventricle because it sends blood out all the way to the body. Why not the right ventricle? Well, the right ventricle only sends blood to the lungs, which does not have to travel as far because the left ventricle has to send it all the way to the body. It does have to travel a lot farther than the right side of the heart. All right, and then our third part here is our endocardium. So let's do black. Endocardium. So this is our last layer. And this is the one that lines the 4 chambers of the heart. And it is made of epithelial tissue. Again, it is a very thin layer, just like the epicardium. So I'm going to draw it right here, pretending that it's, again, lining those 4 chambers of the heart, the endocardium. Okay, so we said myocarditis is inflammation of the heart muscle, right? What about pericarditis? Pericarditis is going to be inflammation of the sac. So pericarditis is another condition, and this is inflammation of the sac. And this is going to lead to an increased amount of the fluid, so an overproduction of that fluid. And this can be related to an inflammation, an infection, or an impact to the chest, and it can cause a heart attack to happen. It is something that we see a lot with heart failure. When somebody's heart is not pumping correctly, it leads to basically inflammation of the sac and then an increased amount of fluid. But for the test, you really only need to know this definition: inflammation of the sac, an increased amount of fluid in that sac. okay? So on the test, for questions about the heart, we want to be able to use the wording of which of these is, where's my wording? Which of these is not a layer of the heart itself, or which of these is a layer of the heart itself? So the terminology that the test uses is which is a layer of the heart itself. So if it says heart itself, it's looking for the heart layers here: epicardium, myocardium, endocardium. If it says which is a layer of the sac, you would be looking for fibrous, serous, parietal, and visceral. Does that make sense? So which of these is not a layer of the heart itself would be the sac. Which of these is a layer of the heart itself would be one of the cardiums. Does that make sense to everybody? So technically they're all layers of the heart, but when we say the heart itself, we're referencing the three, because it's like close to the heart or like really around the heart versus the other ones are kind of farther away. Is that clear? Does that make sense for the heart layers, everyone? We're good. Okay, so we want to start talking about the valves. So as we look at our chambers, right, in the heart, we have our right atria, right ventricle, left atria, left ventricle. And we said what? We said that the right atria is going to receive blood from the body. And does this blood have oxygen? No, right? So no oxygenated blood comes in here. And then it's going to travel down into the right ventricle through a valve. And this is called the tricuspid, or the right atrioventricular valve. So what does that sound like? Atria on top, ventricular, ventricle on the bottom. So the right atrioventricular valve, because it connects the atria to the ventricle, and it's also called the tricuspid. Do you see why it's called the tricuspid? Tri meaning three. So it has 1, 2, and then 3 cusps on it. So that's called the tricuspid or right atrioventricular valve. And it's going to allow blood to pass from the atria down into the ventricle. So the valve only really goes one way. It doesn't like let blood go up, it just makes blood go down. So it's a unidirectional valve. If it goes the other way, that's because the person has a problem with their valve, which we will talk about and you guys have to know about, but what it's designed to do is just go one way. So the other side of the heart, the left side, has what's called the bicuspid, or the left atrioventricular valve. Kind of makes sense, right? We've got a right and a left atrioventricular valve. And then it also has a third name you need to know, mitral. Mitral comes from, have you ever seen like a Catholic priest? You know how the Catholic priests wear those like hats that look kind of crazy, like really pointed? So that's a mitral. They're called the bishop form of them is called a mitral hat. And it has like 2 peaks. I always tell people that because I'm hoping that maybe you'll remember that, because a lot of students will accidentally call the tricuspid the mitral. And I just want you to remember it as the bicuspid is the mitral. I'm not really sure. There's probably a better way to remember that than the technical way that it's called. But anyway, mitral is bicuspid. Mitral is not tricuspid. You need to know that. Those 3 names separately. You might get test questions that ask you with just mitral and don't use any of the other names. So make sure you really know that as bicuspid or mitral. Okay, and remember that the left side of the heart, right, this side has our oxygen. That's because the blood that came from the lungs, right, with our oxygen comes into the left atria. So when the blood goes down into the left ventricle, it has oxygen. and it trickles through that mitral valve. When the blood goes down through the tricuspid, it has no oxygen, also trickling through that valve. Okay, so those are called our atrioventricular valves. And then when the blood actually leaves the ventricles, it goes through semilunar valves. Okay, so this side, I want to use a different color. I'm going to use blue. Oops, let's use blue going to the lungs. So this side is going to have our pulmonary semilunar valve. Pulmonary. Remember, pulmonary means lungs. Pulmonary semilunar valve. This is where blood flows from the right ventricle to the lungs. Okay, so we're going to be going up to the lungs. This is my little arrow pointing towards the lungs through that pulmonary semilunar valve. So I'm going to just kind of redirect my blood flow here like that. And then if I'm in the left ventricle side and I'm going to the body, I'm going to be leaving through the aortic semilunar valve. So we're going to just write body here, headed to the body, and this is called the aortic semilunar valve. And this is where blood leaves the left ventricle and it heads to the body. Headed to the body. All right, so we have 4 valves: tricuspid, right atrioventricular, bicuspid, left atrioventricular. What do these connect? They just connect the atrium to the ventricle. What do the semilunar valves connect? The semilunar valves connect the ventricles to another part of the body, right? If it's going to the lungs on the right side, it's the pulmonary semilunar valve. If it's going to the body on the left side, it's the aortic semilunar valve. Okay? All right. So there's more kind of stuff we have going on here. So we have what are called the papillary muscle and the chordae tendineae. So let's do chordae tendineae like this. So these guys are chordae tendineae, and they kind of look like little cords, right? They there is one on each cusp of the valves, okay? So one on each cusp. So how many are there on the bicuspid? 2. How many are there on the tricuspid? 3. Does that make sense? These do not open the valve. Okay. The function of the chordae tendineae is to prevent prolapse. Prolapse of the valve is when the valve, like let's say we're looking over here at the bicuspid. If a valve prolapses, it basically points the opposite direction. This happens if a chordae tendineae breaks, okay? So if somebody has, usually I believe this happens if somebody has like extremely high blood pressure or blood volume. So let's say you ended up with like so much water in your blood, you have like a massive amount of blood. This does happen to like patients in the hospital, and you get your heart is so like overloaded, you could say, or so full that the valve prolapses and goes back the opposite direction because one of the chordae tendineae break. So if they break, prolapse results. And yes, you do need to know about prolapse for your test. That's not just something like I know off to the side. So if a chordae tendineae breaks, you need to know that prolapse results from that, okay? And we'll talk about partial prolapse versus complete. Then we have papillary muscle, okay? There's one papillary muscle per chordae tendineae. So I'm going to redraw my valve, draw my chordae tendineae, okay? So one papillary muscle per chordae tendineae. So the papillary muscle, this does not function in any way to prevent prolapse, right? We just said that the chordae tendineae are the ones that prevent prolapse. These papillary muscle hold the valve to the floor or the bottom of the ventricle. So they're kind of there to keep the chordae tendineae in place. Does that make sense? Keep the chordae tendineae in place. That's the function of the papillary muscle. Keep chordae tendineae in place. Okay. All right. So if one chordae tendineae breaks, we call that a partial prolapse. If all of them break, we would call that a complete prolapse. So I'm going to kind of draw that up here. So partial prolapse. Okay. A partial prolapse is the same as a leaky valve. And if you have a partial prolapse or a leaky valve, this is when one chordae tendineae breaks. This is audible, so you can hear this as a murmur. So we're going to put murmur. Okay, on your test, it sounds like a murmur. This can be surgically repaired, so this is not deadly. Obviously, you don't want to have this. Does this sound like something that's good? No, but it is not deadly. You can live through it and you can get it fixed and you can live a long and happy life. If you get complete prolapse is going to be deadly. So complete prolapse would be if your entire valve goes back the other way, like I kind of had said. This is deadly, right? This is the entire valve prolapses and no blood flows down. So if no blood flows to my ventricle, no blood flows out to the body, no blood flows out to the lungs. If I don't have any blood to my body and I don't have any blood to my lungs, doesn't it make a lot of sense that that would be deadly? Are you tracking? So no blood can move forward, no blood can come down. Instead, the blood is just sitting up here without ever going anywhere. And so you just get death pretty immediately because you don't have any oxygen to your cells. Okay, so that's partial prolapse and complete prolapse. Okay, so we'll keep talking about the valves because there's some more stuff we need to know about that. So valves in the heart open and close not by the chordae tendineae, right? Because we just said they do not open the valve. So the way that the valves are going to open and close is by a pressure gradient. So pressure gradient opens and closes the valves. So when blood begins to flow down into the ventricle, so we'll kind of draw that. As it trickles down, so it's, again, here's my arrow, the blood is flowing down into my ventricle. It builds up and starts to press onto the back of this valve here. Does that make sense? It's kind of coming around and pressing on it. When it gets full enough, it gets behind the valve and forces it shut. So when the ventricles fill up with blood, the blood forces the AV valve. So those are our atrioventricular, right atrioventricular tricuspid, left atrioventricular mitral bicuspid. So we just call them together the AV valves. So forces the AV valves shut. So that's how the AV valves close. As for the semilunar valves, they will also close after the ventricles pump. So basically, we picture these semilunar valves. They get blood coming up here, and it's on its way out, coming up here, on its way out. And then essentially at the end, a little bit of blood falls back on the semilunar valves, a pressure gradient, and it closes the valve. So it's really the same exact principle for both. They open and close based on a pressure gradient. So on the test, you're not going to answer that the chordae tendineae open the valve. You're going to answer that the pressure of blood opens and closes the valves. Okay. So we just said that the AV valves shut and the semilunar valves shut. So they actually happen at the same time. So when your heart beats, it's a little bit confusing, but I'll try to say it so that we all get it. So the ventricles both work at the same time, and the atria work at the same time. Whenever you guys learn the heart, it's way easier to learn it without thinking of it that way, because it makes it a lot more confusing to try to picture everything happening at once. But your body is very efficient, and it's not going to waste time just doing one side of the heart and then the other side of the heart. It can multitask, right? So because of that, we have two sounds you hear on a stethoscope, and this is something that you'll be tested on. So there's a lub and a dub. So if you've ever listened to somebody's heartbeat, it sounds like, dud, dud, lub, dub, lub, dub, lub, dub, right? So the lub sound is going to be your AV valves closing. And like I just said, they close together. So this would happen, the AV valves closing together. This happens when the blood goes to the lungs and to the body. So the AV valves close when the ventricles pump. So AV valves closing is your lub sound. Your dub sound is obviously your semilunar valves closing. Okay, and this is when the atria are refilling with blood. Okay, lub sounds AV valve closing, dub sounds semilunar valve closing. So that's just pretty simple, but that will be a test question for sure. You'll have a test question on that. Okay, so that's kind of some of the stuff with the valves. It's mostly focused on the valves. And then we'll also talk about some of our blood vessels that flow into our different chambers. Okay, and then what else? We'll keep going with some of the, yeah, that's a good stopping point. Okay, so we'll keep going. We'll be able to get through all of our different blood vessels. And then next week, we'll resume with like arteries. But I'm kind of going to stop once we do our blood vessels, and we'll go over the heart model and then some practice questions, okay? Because I don't want to like just bombard you with all of this and try to get you too confused. All right, so we've kind of covered like the basics of the blood flow through the heart, and we talked about the valves. So let's talk about the blood vessels. So if you're picturing this heart, right? And yeah, I know I have to draw it every time. It's the same thing over and over, but if you draw the heart in your notes, it should help you guys learn it. When I was learning, I noticed that the more I drew this stuff out, the faster I got it. And now, in nursing school, I still will draw it out when I'm kind of going over it. It does help a lot. So the right atria is going to receive blood from the superior vena cava and the inferior vena cava. So those are two of the vessels that will bring blood back to the heart. The superior vena cava is going to bring deoxygenated blood from the armpits up. So if you picture your armpits and above, that'd be like your head, your neck, all of that is coming from the superior vena cava. The inferior vena cava is bringing blood from the armpits down. okay? And then we have the coronary sinus. Keep drawing in black. Coronary sinus. This one brings deoxygenated blood back from the heart muscle itself. So this is a topic that is really important. So your heart muscle, your myocardium, right? And like the other layers around the heart, but mainly the myocardium. All of those myocardial cells need oxygen, right? So your blood is going to pump to those cells, all the myocardial cells, and then they're going to use up that oxygen and bring it back to the heart. So the deoxygenated blood from the heart muscle itself comes back into the right atria through the coronary sinus, also called the coronary vein. And then finally, the other vessel we have, and I'll try to kind of, I'm going to draw it in a little bit of a different color here so it kind of sticks out. This is the azygous vein, okay? So the azygous vein does not drop directly into the right atria, does not go directly to the right atria, but into the superior vena cava, SVC, then into the right atria. Okay, so which of these vessels brings back blood to the right atria? I'm not going to write out superior vena cava and inferior vena cava. I feel like you can see it right there. So I'm just going to do abbreviations for everything we just talked about. Azygous vein is AV, coronary sinus is CS. You won't get abbreviations on the test. It's just for the sake of time that I don't want to write all those out again. All right, so let's answer this question. So which of these does bring back blood to the right atria? And remember, this is not a select all but apply question, so you can only select one answer. Good. I have quite a few people chiming in with E. So the reason that E is correct is because all of these bring back blood to the right atria. So I know that I said, right, that again, azygous vein does not go directly into the right atria, but into the superior vena cava, then into the right atria. So in a sense, the azygous vein is still bringing back blood to the right atria. Specifically, the azygous vein picks up blood from the chest cavity or the thoracic cavity. Good. So for the test, you do need to know that for the location of where each of these is bringing back blood to the right atria. You need to know those locations. Good. All right, hopefully that made sense. All of those are bringing back blood from the into the right atria. Okay. All right, so on the surface or the edges of both of the atria, we have a little structure called the auricles. And the auricles are like a little storage pouch for extra blood. So they kind of look like this. It's not an exact science, but so the auricles, these are extra pockets on the atria, okay, They are kind of on the inside of the atria that allow the receiving of extra blood. So in the sense that if the atria need to allow for additional accommodation of extra blood, the auricles can do that. And then they also will help equalize blood flow after you've been sedentary. So let's say, we're all kind of sitting here during this SI session. We've been sitting for a little while. Our blood is kind of pooling on our venous side. And that's because your venous side has less basically musculature that pushes it back to the heart. So the veins pool blood because they can't push blood to the heart. And so the auricle helps restore that balance. Helps restore 50-50 balance. There's a lot of, I think there's a long portion in your lecture about like 60-40 and all of that. You don't need to know 60-40, just know 50-50. And they are on the interior of the atria, the auricle. On your model, it looks like they're on the exterior, but they are actually on the interior. Okay. We also have lining the heart. We have what are called trabeculae. These are in the ventricles. So I'm going to kind of draw them like this. Trabeculae. That should sound familiar because we just talked about it in the bone. But trabeculae are also found in the heart, and these allow the accommodation of blood in the ventricles. So again, kind of that same function, allowing more blood to be in the ventricles. The ventricles are very thick with all of that cardiac muscle, so we want to make sure there's plenty of room, and so we put those trabeculae there to allow there to be plenty of room. All right, any questions at all on this? And I want to talk a little bit about our different, a little bit more about our different vessels and valves going through the heart before we start talking about some different practice questions in the heart model. Again, next week, we're going to go over the PQRST wave, the SA node, AV node, all of that. So we're still not quite done with the heart, and we're going to be able to go over a little recap on Monday, but this should get you guys pretty well started for your studying for the weekend. Okay, so remember that when we're looking at our heart, we have our, I ended up with a black heart, okay. We have our chambers, right? Right atria, right ventricle, left atria, left ventricle. And remember that the right side has no oxygen. I know I've said some of this stuff over and over, but it's really important, so I don't want you guys to kind of forget it. And remember that we have our tricuspid, and it flows through there to the lower chamber. Now, when it pumps to the lungs, the right side is going to go to the lungs through that pulmonary semilunar valve. When it leaves that chamber, it's going to leave as pulmonary arteries. So first, it will start out as the pulmonary trunk. So the pulmonary trunk is going to be the main portion, and then it's going to branch into the right, I'll just do PA, and left PA. This stands for right and left pulmonary arteries. One pulmonary artery goes to each lung. So the right pulmonary artery is going to go to the right lung. The left pulmonary artery is going to go to the left lung. Pretty straightforward, makes sense. And that's why, because we want to supply oxygen to the blood, right? So that's why we're sending this to the lungs. This blood still has no oxygen in this blood. Notice that these are called arteries. Why is that? Arteries always go away from the heart. So in this case, do the arteries have oxygen? No, right? So in the pulmonary circuit, they have no oxygen. Okay, so that's really important that you guys know this definition. Arteries always go away from the heart. What about veins? Veins, obviously, you're gonna guess, always come back to the heart, right? So in the case of the pulmonary circuit, pulmonary veins actually have oxygen. So this is the thing that is confusing, because some of us learned veins never have oxygen and arteries always have oxygen, but that's not the case, because in the pulmonary circuit, everything's kind of flipped. So again, pulmonary arteries go to the lungs to get oxygen. And then what happens? The lungs give that oxygen, and we basically go through a series of vessels. So it goes from artery to arterial. If you guys have done your little blood flow yet, it's going to go to a capillary bed in the lungs. So we're going to call that a pulmonary capillary bed. And then it's going to start coming back to the heart, first as pulmonary venules, and then as pulmonary veins, all coming back to the heart. So remember that as soon as we get into this capillary bed, we get oxygen and gas exchange. So the gas, the no oxygen blood now gets oxygen in the pulmonary capillary bed. Pulmonary venules, pulmonary veins are going to bring blood back to the heart. This time the blood has oxygen in it, right? So these are our pulmonary veins. And there is a right and a left pulmonary vein. And remember, the pulmonary veins now have oxygen. Oxygen is in the pulmonary veins. Okay. So the pulmonary circuit, what is the pulmonary circuit? The pulmonary circuit is going to begin in the right ventricle, right? We're leaving that right ventricle, and end in the left atria. So for your test, you guys need to know what chamber the circuit begins in and what chamber the circuit ends in. So for this, it would begin in the right ventricle, end in the left atria, because we start out pumping it away from the heart in the right ventricle, and we come back to the left atria. All right, so again, what do you need to know? You need to know the definition of artery vein. You need to know, the pulmonary semilunar valve leads to the pulmonary trunk. Pulmonary semilunar valve leads to the pulmonary trunk, leads to the right and left pulmonary arteries. You do want to know this blood flow for the test as well as your packet. Artery goes to arteriole, goes to capillary bed, goes to venule, goes to veins. Coronary is not a part of systemic. We will go over coronary in just a minute. Coronary is its own circuit as well. It's sort of like systemic, but it's technically its own circuit because it's just to the heart. Okay. Good. Okay, so that was all pulmonary. So we'll put that at the top, pulmonary. So now let's talk about the coronary, since you brought that up. It's a good one. We'll talk about that next. So if we're looking at our heart again, and we already talked about the right side, right atria, right ventricle, no oxygen, no oxygen. We already talked about how it goes to the lungs and comes back, right? And we know that the left side has oxygen. So when we talk about the left side, we're going to talk about the aorta. So remember that the left side has the bicuspid or mitral or left AV valve, right? And then we already said that we know that this vessel here is the aortic semilunar valve. From the aortic semilunar valve, we will then get this large vessel we call the aorta. Okay, the first part of the aorta is called the ascending aorta, meaning it's going away from the heart, it's getting higher. We call this the ascending aorta. This part right here, we actually call the aortic arch. And then as it goes down, we call it the descending aorta. Okay, and we're going to talk about the branches off the arch in just a second. The very first thing that comes off of the ascending aorta are the coronary arteries. So I'm going to do this in black just to make it stick out. So they kind of branch, and they're going to supply both sides of the heart. So these are the coronary arteries. We have a right coronary artery and a left coronary artery. There's a right and a left. These are going to supply the heart muscle with oxygen, right? With oxygenated blood. Everyone can see that, right? Because we know that our left ventricle pumped blood with oxygen here. And then what I'm saying, what this drawing is showing you is that as the blood is flowing up, some of it gets diverted and goes off and supplies the heart. The rest of it, let's say 90%, continues on and goes out to the body. But we'll just say 10%. Let's say 10% goes down here, 5% maybe over to this side of the heart, and let's say 5% to that side of the heart. 90% going off to the rest of the body, but 10% stays in the heart to make sure the heart gets the blood that it needs. Does that make sense? So coronary arteries are going to supply the heart with the blood that it needs. What about when the heart is done and has its oxygen? How is it going to return that blood? Remember, we learned about the coronary sinus, right? So the coronary sinus is how your heart returns deoxygenated blood to the right atria, right? So for our coronary circuit is going to start at the left ventricle, right? And end at the right atria. So where does the blood leave? It goes here out the left ventricle. Where does the blood actually come back once it's deoxygenated? Right here into the coronary sinus. So these guys would basically kind of form a little capillary bed and then come back over here. Is that making sense? Coronary circuit starting at the left ventricle, ending at the right atria. When somebody has a heart attack, so if you have if somebody has a heart attack happens in the coronary arteries. So this is where we have a heart attack. You don't need to know that for your test, but I feel like that's really good knowledge to know, just like in general. I mean, how many people do you know that have had a heart attack, right? So the heart attack happens in the coronary arteries. So if you picture a clot in a coronary artery, now we have death of the heart muscle, right? If the heart muscle dies, blood doesn't get to the body. If blood doesn't get to the body, you die, right? You die really quickly. That's why a severe heart attack can kill somebody. That makes sense? Heart attack affects the coronary arteries because it blocks them from supplying the heart with its blood supply. Okay? So that's the coronary circuit. So let's talk about the systemic circuit next, and we'll talk about the aorta a little more to talk about that. All right, so for the systemic circuit, we're pumping blood to the body now. So right atria, right ventricle, left atria, left ventricle. We know that this side has no oxygen. So we're not going to be talking about that at all with the systemic circuit. We're talking, well, we are in the right atria, but we're beginning on the left side. So this is receiving blood from the lungs, right? Has that oxygen, going to go through that bicuspid valve into the left ventricle with oxygen. It's going to leave out the aortic semilunar valve into the aorta. Right? This is our ascending aorta, our aortic arch, and then our descending aorta. Okay, so our aorta has some anatomy that you guys need to know. So these are the iliac arteries, is when the descending aorta branches. That's one of the things that you should know. But the primary thing that we want to talk about is the branches off of the aorta. So like we had said, we have our first one, which is our coronary arteries. So number one, coronary arteries. These are our first branch off of the aorta. Then we have three more. I'm going to erase this. And these are going to be our brachiocephalic trunk, BT, brachiocephalic trunk, LCC, left common carotid, and then our LS, left subclavian. Okay, so brachiocephalic trunk, this is going to be supplying the right side of the head and the right arm. So the brachiocephalic trunk supplies, I'm gonna have to erase this, right side of the head and the right arm. And this is because the brachiocephalic trunk is actually going to branch as well. And it's going to branch into a right common carotid and a right subclavian. So the right side of the head is going to be the right common carotid. And then the right arm is going to be the right subclavian. So you need to know the name brachiocephalic trunk, and you need to know that it supplies the right common carotid and the right subclavian. So I'm going to try to draw that. So basically I'm showing you that there's a branch here and here. This would be RS and RCC, and then down here, brachiocephalic trunk. The left CC, the left common carotid, this is going to supply the left side of the head. The LS, left subclavian, is going to supply the left arm. Does this make sense? So we have left side of the head, left common carotid, left side of the arm, left subclavian. The right side of the arm and right side of the head have the same names, but they branch from the brachiocephalic trunk. Does that make sense what they're supplying? The brachiocephalic trunk is going to be number 2, left common carotid number 3, left subclavian number 4. So what do the numbers mean? This means that the brachiocephalic trunk is the second branch off the aorta. This number 3, third branch off the aorta. And then number 4, fourth branch off the aorta. And then number 5 is our descending aorta. That's going to be the 5th branch off the aorta. But then it gets a little tricky for the test because we also could ask you, what's the branch off the aortic arch? I'm going to try to make this blue to kind of stand out. So if we're talking about the aortic arch, let's erase this. Talking about the aortic arch, that's kind of this part where it's tall and curved. The aortic arch only has, right, it doesn't start with the coronary arteries. Does that make sense? Because the coronary arteries are way before the aortic arch. So the first branch off the aortic arch is also the brachiocephalic trunk. So make sure you read your question carefully. Is it asking you aortic arch or aorta? The next branch off the aortic arch is the left common carotid. So kind of out of room. I'm just going to write number 2. I guess I'll draw it up here. Second branch off aortic arch. Number 3, third branch off aortic arch is going to be the left subclavian. Good. Third branch. I'll put AA, aortic arch. The descending aorta is considered the fourth branch off the aortic arch because, like I said, if we start at the aortic arch, it's the fourth branch. If we start all the way back at the aorta, it would be the fifth branch. So make sure you read your question carefully. Is it asking you aorta? Is it asking you aortic arch? And then you would answer accordingly. Does that make sense to everybody? So what is the coronary artery? It's just the first branch off the aorta, and it's not at all linked to the aortic arch. After the iliac arteries, the blood starts to branch further. So it branches into like the splenic, gastric, renal, hepatic, intestinal, and mesenteric arteries. I'm saying them very quickly because I feel like those are all very like straightforward. You already have those all in your notes. So I don't really think it's in any way necessary for me to help understand them again. This is just to show you that this branches to the organs. So, you know, if you have the liver will be supplied by the hepatic artery, the kidneys by the renal artery. Is that making sense? So I don't really feel like I need to rewrite that. I think that is pretty clear. All right, so like I said, Monday we will go over the rest of this stuff. I'm thinking right now, the heart model. Does that sound good to everybody, doing the heart model? Any of these screens you'd like me to go back to before I erase everything? When I close all the screens, I erase them. If there's anything you needed to write, I guess I can just go back. I'll just go back to them really quick in case there was one. So this was coronary circuit. This was pulmonary circuit. The one we just did was systemic circuit. And we talked about the different branches off the aorta. Oh, I realized I didn't ever write systemic circuit. Systemic circuit is going to start. Systemic circuit begins at the left ventricle and ends at the right atria, because remember, once we supply the whole body with all of that oxygen, what happens? It comes back from the body into the right atria. Okay, so that would be the systemic circuit beginning at the left ventricle, ending at the right atria. What else did we do? We also talked about our different like kind of appendages, auricle and trabeculae. We talked about the different ones that enter into the right atria. We talked about our valves, how they open and close, and the sounds that they make. And then we also talked about the layers of the heart. Okay, so just keep going over it, keep writing your heart down, and you should get the hang of it. Okay, so let's go over the heart model, and then we'll kind of end on that note. All right, so no one needs any screens, I'm guessing, if no one's saying anything. All right. So, oh, sorry.
Yeah.
Sorry. Thing. Do you have a specific question? Just because I'd have to write it all again.
I just needed the fast screen.
Okay, I just can't, I have to, you were wanting the coronary one?
Yeah.
So the coronary one, remember that would start with the coronary arteries and then it would end with the coronary sinus.
Oh, okay.
Sorry, I just, like I had said, it once I X out of them, it erases them. So just maybe next time just tell me right away, and then that way I can make sure I go back to it for you. Sorry, I missed you right as you said it.
No, it's all good.
Okay, so remember that we have our list of terms that we need to memorize, and then we have our pictures. Let me show you something really quick before I do that. In your study resources module, right here, everybody should have a study resources module. This exam, we have a lot more practice questions. I created a lot of them myself, and then there's also even more. So I know last exam there wasn't a lot of practice questions. This time you should have about, I believe it's 200 practice questions available to you, all for our content. So if you click on this one right here, lecture exam 2 practice problems, there are ones for articulations, ones for cartilage and bone, cardiovascular, respiratory, and digestive are your next topics. In addition to that link, there's extra unit 2 practice questions. These are ones that I made for previous SI sessions. I might go over some of them in SI, but here's 30 questions. And then there's another, like, I think 50 questions on this one. I would recommend saving at least some of them for the weekend before the exam. I would, if I was, kind of giving you my advice, use these ones, the bonus practice questions and the extra practice questions. You could maybe use those now, or you could use these ones now, but save something for the weekend before the exam so you can kind of quiz yourself. These are nice because they're a little more organized. Again, I just made these during an SI session for everybody, so they're not as organized by chapter, but there's still a lot of content, a lot of like good practice questions for you. So you should have about 200 practice questions available for this exam. I really recommend using those. So I just didn't want to forget to tell you guys about that as a resource for you, okay?
I have a question.
Yeah.
So the practice questions, are they like the same level as the exams? Or are they really easy? Like
They should be the same level this time. Yeah.
Okay, thank you.
As always, some will be easier than the exam. They're not all going to be, as hard. But I definitely tried to make, especially the ones I created, I tried to make a lot like the exam, like more difficult. And there should be rationales, like explanations for why. I think I have one typo. Somebody wrote me about one of them that has a typo, but the answer should be here. And some of them have like an explanation because there was like some confusion. And if for any reason you find a typo or something that's missing, you're welcome to message me and I can fix that on there. Sorry if there is a typo, but for the most part, they should be accurate. I think I had one person say there was like one error somewhere in there. Okay, so for our heart, this is kind of nice because we just went over it. So I'm going to try to kind of do this as like our little review. So let's see if I can get a picture that I like. So let's look on, let me see if we like this one. This is pretty good because at least we see it open. So right here at the top, let's see, this is going to be our right atria, right? And then do you see the little like folds here? That's our auricle on the right side. They're like these little like folds or pockets. Oh, sorry, it's technically it's up here, auricle. It's not down here. It's that little like pointy thing. And then we lead into the right ventricle. And we can't see that. Let's do this, right ventricle. These little folds on the side, everybody see kind of these little wrinkles. Those are our trabeculae. This would be our pulmonary semilunar valve. Sorry, it's not super easy to see. There's not a great color, but pulmonary semilunar valve would be right here. So remember that the right atria is going to flow down into the right ventricle through the tricuspid valve. The tricuspid valve is missing on, like, you can't really see it in this picture, but it would be there if you could kind of look up inside. So that's the tricuspid or the right atrioventricular valve. So that's kind of the right side of the heart. So we get the blood into the right atria, go to the right ventricle, out through the pulmonary semilunar valve. All right, and then let's go up here. So we go out through the pulmonary semilunar valve, right? And then after the pulmonary semilunar valve, we get into the pulmonary trunk. So this is our pulmonary trunk. This would be our left pulmonary artery here. And then over here, our right pulmonary artery. And now we can kind of see the top of the right atria as well. And this would be our superior vena cava here. And then these are 2 vessels leading into superior vena cava, but you don't need to worry about that, okay? You can see here our left atria, and you can also see kind of in the back, the pulmonary veins. Do you see them? They're like these red structures here, pulmonary veins. So right pulmonary artery, left pulmonary artery, pulmonary veins coming back into the left atria. And then we also have an auricle on the left atria and then our left ventricle. Okay. Then remember that the left ventricle pumps blood into the aorta. So we have the aorta. We have the ascending aorta right here. Okay. And then the first branch off of the aorta, right, wasn't it the coronary arteries? So you can see that right here. You guys see these red vessels? It has like a number 11, and then there's one over here. So that would be the right and left coronary arteries. This would be the right coronary artery. And then the one over here, the left coronary artery. Okay, that making sense? All right. Okay, so that would be the flow that you can kind of see here. And then let's rotate the heart and look on kind of the back side and through the chambers. So if we open up the left side of the heart, you can see here the aortic semilunar valve. So this would be our left ventricle. Sorry, I don't know why I said left ventricle. Left atria. And then left ventricle at the bottom. And then this would be our aortic semilunar valve. It's hiding right there. Let me see if I can do a little arrow right here. All right. And then this structure right here, I didn't mention this, I forgot to mention this just now when we were going over the aortic arch. So this is called the ligamentum arteriosum in adults, or the ductus arteriosus in children. Technically, we're going to say infants. The correct word would be neonates, because it closes like a few hours after birth. This function is to connect the deoxygenated and oxygenated blood in utero for babies, because babies don't oxygenate their blood. So for what this is trying to say is you have your deoxygenated blood and oxygenated blood when you're an adult, right? Like we keep talking about, the left side of the heart is oxygenated, the right side of the heart is not oxygenated. When you're a baby, you don't oxygenate your own blood, so you actually keep those two connected through this duct or this like open port. And this is called the ductus arteriosus, okay? So it's keeping those two connected. When it closes and becomes the ligamentum. This holds the aortic arch in place. So when you're an adult, you have this heart that's beating all of this blood out and you want to keep that held in place. And that's called the ligamentum arteriosum. For your lab exam, you do need to know ligamentum arteriosum in adults, ductus arteriosus in children, infants, neonates. Okay, neonates is just the proper word for like an infant right after birth. So, you don't need to know all of this function I wrote out for the lab exam. You would need to know that for the lecture exam. For the lab exam, you need to know in adults, it's called ligamentum arteriosum. In neonates, it's called ductus arteriosus. Does that make sense? So the two names is what you need for the lab exam. The function you would need to know for the lecture exam, as well as the names. Good. So I forgot to mention that earlier, but it will be on both exams. All right, here we have the pulmonary veins. You can see those again. And it looks like we just got to 11, but I'm just going to spend, I think I only have like 2 or 3 minutes left and I can finish this model up. So just hang with me. So looking at the back of the heart, you have your descending aorta here, descending aorta. This is your esophagus, the smooth one. Your trachea is here going down to the lungs. And does everybody see this little vessel here? It's called 59. That is your azygous vein. I know we can't read that. Let me see if I can change the color. Azygous vein. That's this one right here. Number 59 here. Good. Esophagus, trachea, and then these are your bronchi. So this would be your left bronchi here, and then this over here, your right bronchi. Okay, left atrium is what we see overall at the back. And then you do need to know the branches off of the aorta on this model. So I'm going to flip the heart around because it's kind of hard to flip it in our heads. So we'll go back to that. So again, this would be what you guys would identify on the back of the heart. All right, so in the video, he shows you guys how there is this model we have in lab that basically has these different branches off the aorta. So you do need to take a look at that, and I'll just try to kind of label it from this image. So this would be, let me see if we can, I'll just do it like this. So this guy here is that brachiocephalic trunk we talked about. Oh, now I'm on black. Brachiocephalic trunk, right? The next one is our left common carotid. And then the last branch is our left subclavian. And then remember what we said that the brachiocephalic trunk actually branched, right? I'm going to change the color. It branched into the right common carotid on the inside. And then the the right subclavian here on the outside. So how do you remember that for your lab exam? The way I remembered it is subclavians are on the outside. So if you guys look, subclavians would be on the outside, subclavian on the outside. And if you think about the alphabet, right, the edges of the alphabet would be S, like S comes later in the alphabet, versus common carotid or C comes in the middle or the beginning of the alphabet. So common carotids are in the middle, subclavians are on the outside, right? Both subclavians on the outside, both common carotids in the middle. As long as you remember the brachiocephalic trunk is the one that then branches into the two on the right. Okay, so that is something that will appear on the lab exam. You'll be tested on those. Okay. All right, so I'll just cover the last few things. So there's a few veins that you need to know. This one There's the 46, 27 should be coronary sinus, and this should be great coronary vein. Sometimes I say I'm wrong, so I don't want to say I'm wrong for you. So 27 coronary sinus, and then our 46 cardiac vein. So like I had just shown you on that picture right here, this would be coronary sinus CS right here, 27. And then this one would be cardiac vein. Okay, and that should be, I think I got 99% of the terms. If I'm missing something, this one's inferior vena cava. If I'm missing something and you can't find it, let me know. But that hopefully gives you a visual of the heart through the model, and that helps you a little bit more as you study it. When I was doing my lecture, when I was in the class, I printed out one of these photos and I stuck it in my notes, and that kind of helped me. And then I kept drawing it out. So I definitely recommend practice questions, recommend drawing out the heart a lot, practicing with it, and don't get behind, because the more you go over it, the more it will make sense, and you guys will definitely get there. All right, I will see you on Monday. We'll go over PQRS T-wave, and we'll go over SA, AV, and electrical conduction. I do not have tutoring today, but let me know if you guys have any questions through the chat, and I'll see you on Monday. Thank you guys for coming.
Hey, sorry, quick question.
Yeah.
Where do we get the extra unit 2 practice questions on our Canvas?
They should be available to everybody. I should have had them published. Let me see if maybe they're not published for Bender's class yet. Oh yeah, they're not published. I'll just publish them for you. Sorry.
Okay, thank you.
Yeah. Christopher, I just saw your question about trabeculae. There are trabeculae in bone, and then there's also trabeculae in the heart. So both the heart and bone have trabeculae. In the heart, it functions to allow more blood to fit in the chambers, whereas in the bone, it functions to allow there to be blood created in the spaces, but they're both called trabeculae, but they have different functions, but they are both called the same thing.